Dr. Tan, tocotrienols have been found to reduce cholesterol and triglycerides. Could you explain how that happens?
The pathways about how the body regulates cholesterol and triglyceride are different. The cholesterol is made in the liver, and the triglyceride also in the liver and elsewhere. When you lower cholesterol, you're able to lower arteriosclerosis, the thickening of the artery, or cardiovascular health. If you lower triglyceride, I'll take a step back. If you lower triglyceride, it would also help people with cardiovascular benefit. But triglyceride has a slightly different direction besides just cardiovascular health. It particularly is important with people with diabetes or pre-diabetes. And let me take a little detour on this, because this is important. When a person is diabetic, everybody knows their sugar has gone rampant. The doctor would tell them, and that would not be good. But you know, it takes a lot of time, a long time, before we abuse our body, and then the sugar would go so high. And I would like our audience to know about this. And that is that before your sugar goes way up high, your body tries to compensate as much as it can to make the sugar not go up high. And that is the part that people do not know. And when the sugar is low, it's forcefully kept low. And to compensate for that, the triglyceride go up. And that would be characteristic of somebody who is pre-diabetic. There are many synonyms of pre-diabetes. We use phrases like metabolic syndrome, insulin resistance, syndrome X. They all meant the same thing. But let's simplify the phrase, pre-diabetes. What does it mean? It just means just before you become diabetic. It's as simple as I can say it. And in a person who is pre-diabetic, the sugar is normal. If the sugar is not normal, then they're diabetic. So the sugar is normal and the triglyceride is high. Now, when that person becomes diabetic, the sugar is high, and usually the buck stops there. Actually, a person who is diabetic, the sugar is high, but the triglycerides stay high. So essentially, when the triglyceride is like the Hoover Dam, the triglyceride just keep higher and higher until it cannot hold up. The dam just bursts. When the dam bursts, the water floods out. That's when the sugar runs high. So in other words, the sugar is kept low only because the triglyceride compensating it. So this is the thought. When you go and see the doctor, when the doctor get a lipid profile, the lipid profile, usually people look at the cholesterol, but the triglyceride is in the lipid profile. So always take note, how is your triglyceride doing? If the triglyceride is high, then that person is in a state of metabolic syndrome, pre-diabetes, or insulin resistant, even though the sugar may be high. Now, this is the good news. Tocotrienol lower triglyceride. Therefore, it assists and help people to help people with the triglyceride level. So if that is done right, then they never see diabetes and actually reverse from pre-diabetes back to normal. Now, typically, what are some nutritional supplements that are very good for modulating and controlling triglyceride? The first that come to mind is fish oil. So therefore, taking fish oil and tocotrienol is a very good way to lower triglyceride. But tocotrienol also lower cholesterol. So it not only addresses hypertriglyceridemia, it also addresses hypercholesterolemia. Hyper just means high. Hypercholesterolemia. So if this is too big mouthful of two words, then it's actually addressing dyslipidemia. Because they're both lipids, you know. So when addressing those two, they are good and good. It's a win-win because you're addressing something that is for cardiovascular benefit, but actually addressing something that is also true of a person who have a risk factor in being diabetes.
Excellent. Thank you very much.